Most of this is going to be voiceover anyway, and as Brad points out, just think of it as a kung fu film. So most of the stuff I'm going to be doing again today is going to be just taking a look at an article, a really excellent article, and it is called "Evidence Over Hysteria." And it's a statistical analysis of the data as it exists. Now, I'm going to qualify all of this, but I'm going to try and give you at least a broad perspective from a non-scientific point of view. And fortunately, we have some people kind of keeping an eye on things. So let me start this little presentation, and then we'll get going here. Okay, so first thing first, flattening the curve. What does it mean when we say flatten the curve? Well, what we're trying to do is not so much reduce the total number of cases, and I know some of this is stuff that you guys already know, but we'll just kind of go through it step by step. The general idea is not to reduce the number of cases. That'd be nice, but what we're basically talking about doing is extending the period. If you look at the purple bell curve, extending the period, making it take longer for the people that are going to be infected to get infected. You can see there's that kind of light blue, kind of a cyan colored line that says capacity of the healthcare system. The yellow curve is what happens if we don't do anything. If there's no social distancing, no intervention whatsoever, that's what an outbreak with this degree of infectiousness looks like. You can see that it's shorter. It doesn't last nearly as long as the purple curve. The bottom line, the horizontal line, is time. So if you look at the yellow curve, the curve if we don't do anything, you can see that the outbreak happens, the number of infections rises just absolutely dramatically, gets to the peak there, and then comes down, and the actual length of time of the pandemic is considerably shorter than it would be otherwise. But that's the kind of survival of the fittest approach. I mean, if we don't do anything, if we were to protect the economy at the expense of the people, we'd have an orange curve like that. We would basically say, all right, it's going to happen. We're going to take our hits, and whoever's going to get sick is going to get sick. Whoever's going to die is going to die. And you can see on the orange curve that very quickly that orange curve exceeds that horizontal cyan line. That's the capacity of the healthcare system. So if we don't do anything, basically what happens is the infections start, they blow right through the ability of the hospitals to cope. Once we get to that cyan line on the left side of the curve, that's when the hospitals are overwhelmed, and you can see the cases just keep coming and keep coming and keep coming all the way up to that tall peak. And then down on the backside again until we get below that cyan line again. That entire top of that curve is people who are not getting treatment because the system is absolutely overwhelmed once we get to that horizontal blue line, light blue line. That's if we do nothing. What we're trying to do, the overall strategy, and why we're taking the economic hits and all the rest of this stuff that we're taking, is that we're trying to get to the purple line. Now, I don't know if we're going to be able to get to it, but this is a nice curve, a nice graph, because there are no actual numbers attached. This isn't what we're doing or what we expect to happen. This is a theoretical target. So flattening the curve means that we're willing to extend the length of time of the outbreak and make it last longer. But the entire reason we do that is to make sure that we can keep the total number of cases, that'd be the purple curve, underneath the capacity of the healthcare system. Everything we do to flatten the curve is essentially, we're not stopping the disease to the degree that we're not reducing the total number of people that are going to get infected. I'm speaking hypothetically. This is some generalizations involved, but just this is the guts of it. So what we're basically trying to say is, imagine the area inside the orange curve and the orange inside the purple curve are exactly the same, just for the sake of the argument. Let's just assume that the total area of orange and the total area of purple are the same. That means the same number of people are going to get infected. What flattening the curve means is it means extending the amount of time it takes for people to come down with the disease and then recover from the disease, so that we never reach a point where we have exceeded the capacity of the healthcare system to deal with it. Now, this is an ideal, needless to say. I don't know whether we'll be able to get there. Nobody really does. It's starting to, well, Nobody knows, to be honest with you. But in any event, regardless of what the actual numbers are, this is the goal. This is the entire goal, and so on. Now, if we were to lock everybody into their houses, everybody, and if we, let's say we'd done it again, sometimes the easiest way to think about things is to go to the extremes, right? The extremes. So the orange curve here is what would happen if we did nothing. Let's say that the second we heard that this thing had appeared in Wuhan, we locked every single American into their houses and let maybe 1% of the population outside. That would flatten the curve all right. It would definitely extend the curve because it would keep the numbers even lower. But at what point does flattening the curve mean you're doing more harm than good overall? If you locked everybody into their houses, including doctors, again, theoreticals are really good to go to the extreme because they help clarify things. So if we locked every single doctor, nurse, and every single human American in their houses at the instant the outbreak occurred, we'd have a very, very, very flat curve that would last for years and years and years, and the economy would be destroyed. So we have to understand that, well, first of all, we're not going to get there because the disease is already out. Our goal in what we're trying to do as a society is we're trying to extend the time of the total outbreak, but to reduce the peak amount, not the total amount, the peak. Keep that purple peak underneath the capacity of the healthcare system. Most people who get this is not up for discussion. The vast majority of people who do contract this disease are not going to be fatalities. The large majority of these cases are fully recovered. In mild cases, or something in the 80% of them are mild, and even the serious cases that may require some medical attention, survival rate in the early stages in China from Johns Hopkins was saying that mild cases were something like 82%, severe cases were the number 14% additional, and that initial data said that there was a 100% survival rate for both mild and severe. That's Johns Hopkins University, but that data is about a week out of date now, something like that. Anyway, this is the goal. Now the question is, how effective can we be in flattening this curve? We got to it later than some people and not as late as others. So here's that graph I was talking about yesterday. Here's the power of social distancing. This is what social distancing and isolation does to infection. So you can pretty clearly see here, let's just go over it. If you look at the top row, if we were to do nothing, the now means doing nothing. One infected person is likely to infect 2.5 people. They're using 2.5 as the R naught for COVID-19. That's the number that one person is likely to infect. If the number is greater than 1, the disease spreads. If the number is less than 1, the degrees burns itself out. Now 2.5 may be a small number. The actual number may be higher than that. But if the number of people infected, top row now, if it's more than 2.5 people, then the power of social distancing actually increases. So reading across from the top here, you say if we do nothing, we've already not done nothing, but if we had done nothing, one person would infect, if we're going to go with 2.5, one person would infect 2.5 people in 5 days. That's average. And after 30 days, that one person would have gone on to infect through the people they infected. A total of 406 people would have been infected over 30 days if nothing is done. So that's the top section. Now let's go to the middle one. 50% less exposure means 50% less exposure. What that means is if you went out of the house every other day, I mean, it literally means cutting your total exposure to other people in half. And you can think of it as going, at least in the studies I've said, you can think of it as going out every other day. If you cut your exposure in half, then one person doesn't infect 2.5 people, they infect 1.25 people. But look at what happens after 30 days. Instead of 406 people being infected when you do nothing, if you have 50% exposure, 15 people are infected after 30 days. But now we go down to 75% less exposure. That's if you cut your social contacts by 3/4. If you do that, if you go out 1/4, if you have 1/4 of the human contact that you would normally have, meaning you go to work 1 every 4 days, and here in California, it's way below this. You can see that at 75% less exposure, one person infects 0.625 people. That's less than one person. That means the disease is on its way down. And after 30 days, only 2.5 people are infected. So the main thing to look at with this graph is go to the top one and the bottom one. Forget the middle one. Here's the power of social distancing. On the top, if you read across, you see one person in 30 days would infect 406 people. On the bottom one, if you have 75% less exposure to other people, that goes from 406 down to 2.5. Now that is a remarkable achievement, and that's why we talk about social isolation as a means of flattening the curve and protecting as many people as possible. Okay, now we've got some data up here, but before we go into any of the data, there's one chart that we have to start with, and this is really important. All of this is coming again from, I'll put the link here in the live stream, and I'll also put it on the post on YouTube and so on. But here's the caveat for everything that we're going to say coming up now, and that is simply this. Here's the next chart. This is a total of COVID-19 tests performed per million people. This is not to say that well, it's actually self-evident. You can see that Iceland has tested a lot more of its population, really double, than any other country. That doesn't mean that they've tested their entire population. Let me just have a quick look, make sure I read that data correctly. It looks like Iceland may have tested, no, I don't know what, that's a total number of people. But in terms of tests per million people, think of it this way. This is your database. Okay, if we're looking at Iceland's database, Iceland's got a much wider database because they've tested more people. If you test people who are only positive, in other words, if the only people you test are the people with syndrome, you have no way of knowing how widespread that disease is throughout the general population. In other words, just again, we're speaking hypothetically, if in the United States you test 100 people who all have the disease, then you've got 100% of the population with the disease. But that's not what you want. Ideally, in a perfect world, everybody would be tested. And that would give us an idea of the number of people in the society who have the infection versus those that don't. Ideally, in a perfect world, even this late, we would go down, everybody would get, if you could get tested online or whatever, forget that. Just if you could, hypothetically, then you'd have information that would be solid, because you would then have a way to compare how many people are sick versus the total population, what's the mortality versus the total population. But I want you to look at this chart, and I want you to come all the way down and see there's Iceland, UAR, South Korea is the model out there for many reasons we'll get to. Australia, Canada, Germany, Austria. You can see that they're not really even huge numbers, but look, you go way down, there's Iran, there's France, Finland, United States is very low. Now we have a big population, but our testing is poor. It's increasing, and it's increasing rapidly. So I'm coming back to this chart because all of the data that follows from this is based on a low test sample, and it's got to be taken with that grain of salt. However, with that said, there is some stuff here that looks promising, and I tried to isolate data that was specifically not dealing with the U.S. because our statistical base is so small in terms of the number of people that we've tested. So here's two things in terms of what about the peak? When does the peak infection come? Let's have a look at this chart here. The blue bars are China. Forget it. Just ignore China. I don't believe a thing that's coming out of China. Nothing. But I do believe what's coming out of South Korea. And if you look at South Korea, you can see that South Korea is definitely showing a rise in the case number, and then there's a little bit of a drop, then another rise, a bit of a drop, but you can clearly see that South Korea is, the number of cases is dropping. Now that may be due to the fact that as you test more people who show up negative. There's a lot of stuff hidden in this data that you can't just take as given. You got to really understand that there's a lot of things that can affect this. If it could turn out that Korea's cases were continuing to increase, but if they rapidly increase the number of people tested, it would show a decline because you're testing more people who are turning up negative. But with that said, here's another situation for Korea. South Korea has been doing really, really well. They're the model for how a country should have done this, and there's a lot of reasons for that, and we all hope we're going to do better. But this is data from South Korea, and the South Korea data, which I find to be reliable, and most people do, shows that the number of new cases, confirmed cases, is decreasing, and that's of March 10th, and those numbers appear to be going down. Confirmed cases via testing, not tested patients. So we have an expert here who's always live with us, Lord Bios. Does that mean that this chart showing a reduction in the number of new cases is total garbage? I just wanted to see, because it seems to me that the previous one, but this one looks pretty good in terms of the total number of new cases in South Korea. Look, clearly something's happening here. Something is happening here in South Korea, and South Korea appears to be the model in terms of like early quarantine and social distancing and so on. However, I want to come back to this. There are things that South Korea did, like testing and then finding out who was infected, and then going out and finding out who those people's contacts were. But South Korea did not shut down restaurants or gyms or anything like that. They went after the people who were sick, isolated them, quarantined them, and found out who were the friends of the people who were sick, and went after those people. So this is what kind of an ideal curve would look like. The United States is not going to reach this curve, but clearly, what at least confirmed by our friend Lord Bios here, what it clearly shows is that public health interventions are working. That's pretty much the quote. I think that's a fair way to put it. In other words, it's clear that what we're doing in Korea is having an effect, and that means that what we're doing in America will have an effect. We don't know how big an effect, but some kind of an effect will happen. Now, here's another chart that's interesting, and again, this whole thing might be, what I'm about to show you might be a statistical anomaly, but then again, it might not be. So just to reiterate, I'm looking for good news that seems to be reputable. I'm not going to hide bad news, and if the good news looks good, we're going to try and qualify it. But take a look at this next chart. This is a growth. This is a series of world cases as compared to latitude, and I'll get into why that's important in a minute. The orange line is the number of cases is the world population. So you can see that the world population actually peaks right around 32 degrees north latitude. But then the blue line is the number of infections for COVID-19. And you can see that there are a couple big spikes there, especially big spike at 32.5 degrees latitude. And if you want to see the numbers here, here's what they look like. You can see that the biggest cases are at 32.5 degrees, largest number of cases, and that includes latitudes like Pakistan, Texas, Louisiana, Iran, Hebei, Anu. These are provinces in China. Let's just concentrate on 32.5 degrees just for a minute. Now, I'm going to get to where the false data could be, but just stay with me on this. If you look at 32.5 degrees, you see an enormous spike. It goes off the charts to 89K. But then come down to 22.5. You can see that's India, Hong Kong, Macau, Cuba, and Oman. The drop-off is really significant. Now, again, we don't know how much of this is due to testing. We don't know how much of this is due to we don't have absolute information. If we had perfect information in terms of the number of people who are affected and so on, then we could have utter confidence in this data. But one thing that does strike me is, and the reason I'm bringing this data up is that viruses do have a sweet spot, and I'm going to assume that's different for every single virus, but that certain groups of viruses, like coronaviruses, certainly have a growth environment that they find optimal. one of the reasons, in fact, the main reason that your body develops a fever, the first thing your body does in terms of its own self-defense when it gets sick is it develops a fever. The reason the body develops a fever is because it raises the body temperature, and higher body temperature is something that the viruses don't like. It doesn't necessarily kill them. In fact, I suspect it doesn't do much to kill them, but it certainly slows them down. It reduces their optimum multiplication zone. And if this chart has any significance, what it's showing is that there is a connection between the temperature and the humidity in terms of what this virus likes. And here's the numbers broken down a little bit better. So you can see that there's a temperature zone that it's like, and a humidity zone it's like. Again, I have to constantly say this. We don't know how much of this is due to what percentage of the populations of Texas are tested and so on. But nevertheless, it looks like that this is kind of a sweet spot for the virus. Now, let me just go back a little bit here. This seems to be where most of the flu in the world occurs. I've lived in California and Florida and Bermuda, and I don't remember the last time I had the flu. I think there's no question that the reason that the flu subsides in the summer is because it gets warmer. Now, that may be because people aren't jam-packed together and so on, but nevertheless, what happens to the flu should happen to COVID-19 in general terms. They're both coronaviruses. So we say seasonal flu, and the reason we say seasonal flu is because it's seasonal. The flu starts generally in the fall and goes generally through the spring. In northern hemisphere, in the United States, that's when temperatures are colder, and it seems to be that people in warmer parts of the United States aren't quite as susceptible to the not let me rephrase that. They don't get the flu as often as people in the northern parts do. Now, if this is all true, if it's true, then what that's saying is that warmer temperatures may slow this thing down. This is the summer will save us theory. Now, there's some evidence to indicate that as testing increases in southern climates and so on, that those numbers will start to balance out. Maybe it doesn't have anything to do with temperature. It's possible that it doesn't. But if you look at this, look at the orange bar at the very bottom. The orange bar at the bottom is everything below 2.5 degrees north latitude. That's the entire southern hemisphere. All of it is in that orange bar. So we are coming out of northern hemisphere winter and out of southern hemisphere summer. That means as every day that goes by, it's getting warmer in the north, it's getting colder in the south. If there's something to this theory, warmer weather should slow this thing down, and according to some of this stuff, it might slow it down significantly. Now, that's bad news for the southern hemisphere as they get colder, but every day counts, because every day that goes by, we have that's another day to work on these drugs that are showing some remarkable effectiveness. It's another day of social distancing and all the rest. Every day that goes by is a day that look, the disease is going to proceed at the pace of the disease. The disease doesn't care about anything we do, but every day that goes by is another day for humans to ammo up. And by ammo up, I mean things like chemicals, drugs that fight the ability of the virus to multiply in the system, progress towards vaccines, social distancing, all of this stuff. Every day that goes by helps us because the disease is going to burn at its own rate. So there we go. So if this is true, then, for instance, if you look at 22.5 degrees north latitude here, India, Hong Kong, Macau, Cuba, and Oman, as it turns out, having taught astronomy in Miami, as I recall, Miami was 23.5 or 23.6 degrees north latitude. So you can see that Miami is just a little bit above the 22.5 mark, but well below the 27.5 mark. And that should mean that we are maybe be able to do better in the southern parts of the country because they're warmer now. It's all going to get warmer. That's good for the northern hemisphere if this is in fact the case. What is the case without question is that viruses do have temperatures and humidities that they prefer in terms of their ability to breed. So I find this to be hopeful news in terms of if it has to do with temperature and the temperature is warming for us, that should be good in terms of the growth rate. Okay, again, this next one dealing with sorry. This one is what we've seen so far. This is underlying health condition in China as of February 11th. So this data is old, and it's also Chinese data, but this is one particular area where the Chinese are not as likely to be lying because this doesn't have to do with China versus the rest of the world. This is internal to the numbers that they've already admitted. Okay, so this is what the fatality rate looks like in China, given the underlying health disease. Now, all of these numbers don't so much pay attention to the actual numbers, but just as a bar graph to show relative risk factors, this might be useful. You can see cardiovascular disease leads, and then diabetes is second, respiratory disease is third, hypertension, high blood pressure is almost the same as respiratory disease, cancer is at 5.6, and you can see no health condition. This is the number, this is the fatality percentage in the beginning in China. So that gives you an idea of what the risk factors are and the people who are at risk. So let's look at this. Now, this is the fatality ratio, and this number can be affected by the total number of samples and so on. I understand all of that, but what this appears to be showing is that as time goes on, the fatality rate is dropping. Whether that's, I don't think that's due to the disease changing. I think that's due to, first of all, the testing base is getting larger, so that means the mortality rate is decreasing as a percentage, as a statistical percentage. The more people you test who either don't have symptoms or don't have serious symptoms, if you have 100 people who die and your sample base is 200 people, you got 50% mortality. If that same 100 people die and your sample base is 1,000 people, you have 10% mortality, and so on and so on and so on. But whether or not it's due to an increasing sample rate or potential changes in the virus or whatever, you can see that what is clearly happening in China anyway is that the fatality rate is going down. I bring this chart up only because, as I say, I'm looking for good news that is true, and I'm trying to qualify the good news that is true, and I don't see anything wrong with that so long as I put those caveats in there. This is a chart coming up here that is, again, based on testing and so on, but for the U.S., it offers some kind of hope here. I'm going to have to say this every single chart, and I know it, and I'm sorry, but that's just the way it is. I don't want to be misrepresented. I don't want to give false hope, but at the same time, if there's hope there, I want to present it. What this chart shows is it shows the coronavirus deaths, and you can see that Italy is almost on a line for a 33% daily increase, increases by 33% every day. That's shocking. China's chart is leveling off, but let's just throw China's chart out the window. I don't trust them at all. Spain is growing at an alarming rate, but the reason I wanted to show you this chart was that the countries that seem to be doing very well are Japan and South Korea. Both of those countries have reliable data, and you can see that already. This is, you can see number of days since the 10th death in the country. So you can see that the US curve is approaching the South Korean curve much more than it's approaching either the Italian or the Spanish curve. In other words, if you follow these lines outwards at their current curve, you can see that as time goes on, the number of people dying in Italy versus the number of people dying in the United States as a number of deaths increases. So I brought this chart out because South Korea seems to be virtually the best case of any significant size out there. And The U.S. is following that curve a little more than it is Italy. In other words, I bring this chart out just simply to say it doesn't look like we're going to suffer what Italy suffers, and Spain's lines look even worse. Spain started late. In fact, I heard that as late as a week ago, or maybe 10 days ago now, well after the rest of the world was starting to take this seriously. Spain continued to have large festivals because it was peak tourism season for them, and they decided that that was more important. So, okay. Their trajectory does not look good. Our trajectory does look good. And 10 days since you can see that as of the date of this chart, it looks like if you look at the U.S. dot, right there, the red dot that says U.S., that appears to be at 11 days since the 10th death occurred in the country. Now, I don't know what that date was, to be honest with you. I don't know what the calendar date was. But I do suspect that the U.S. dot and the curve that we see so far does not include, let me rephrase that, does not reflect the social distancing effect. In other words, the quarantines, the lockdowns, the all of this stuff. Somebody said I thought we were up to 250 deaths. This chart is dated March 15th. So we're looking at trends. So this chart is 5 days out of date and 6 days out of date, and that's significant. But I'd really like to see what happens when this is updated, because the one thing that we can say about the last several days is the last week or two. If you look back 2 weeks, we were starting to get serious about things when we were starting to cancel concerts. We were canceling. The NBA canceled their season, and then it got more severe when it turned into okay, now we want everybody to stay home, and then it got more severe where okay, now we're closing restaurants and we're closing gyms and so on. And then it got to the point where it is in California, and it's happening in more states as well, which is do not leave the house unless you need to go out for groceries and so on. That means that most of this red curve on the U.S. is not showing the full impact of social quarantine yet, of social distancing. So that should flatten that curve out significantly as well. Basically, I want to think that is about what I've got so far. So, the main reason I'm doing this show every day is, again, I know I've said it 5 times already. I can't say it often enough. First of all, the statistics are based on sample size, and I'm trying to find things that are indicative of overall trends that can be measured against other countries rather against a perfect ideal or whatever the case may be. But a lot of that was good news. And when we say good news, we're talking relative good news. So what we're going to find out in the near future is 2 things. As we said yesterday on Coronasphere Lounge, the term "here comes the boom" is upon us. Now we're starting to see the number of people who have been infected without symptoms, not knowing it. Those people are starting to get sick. And so now we're going to start to see a really rapid rise in the total number of cases. The big question is, and this is the big question, and we can start to maybe get a handle on this within the next 2 or 3 days. The big issue is going to be, has this social distancing, what kind of an impact has it had? There is no question at all that it's going to have a very large impact. The earlier we did it, the flatter we can make that curve. But there's no question that this is significant behavior, and that we're going to see very quickly, I would imagine, there should be, sometimes I think they call it a knuckle, or is the knee. There's a point in a line where we should see this growth line significantly bend in the direction we want it to bend as a result of these draconian actions that we've taken. There are some countries, the elbow, okay. There are some countries that are doing real well. for instance, South Korea's testing and so on was great. And Germany's fatality rate is just astonishingly low. I mean, it's just out of the park low compared to other countries. They're more or less average in terms of testing numbers and all the rest of it, case numbers, but their mortality is just it's like a really outlier low. I don't know why that is. Maybe the German government has just given orders that no one's going to die from the disease, so that could be it. Put my spectacles back on again here. Ah. Helio says it's because Germany isn't conflating those who died with COVID versus those who died because of it. That is a very, very, very important point. Let me elaborate on that. And again, it's so nice to have somebody who knows what they're talking about. What Helio said is the reason that Germany is the German numbers, the mortality numbers are so crazy low compared to everybody else is because Germany is not saying, hey, this person, here's what we're saying, what the rest of the world says. Person in the hospital dies, they test positive for COVID-19. That's a COVID-19 death. But what Germany is saying is, yes, but did COVID-19 actually kill that person? Or even how, in other words, if you've got a guy who's on life support and is in full-on kidney failure, let's say, or is suffering, advanced heart disease or so on before they get COVID-19, then they get COVID-19 and they die. The question is, how much of an effect did the virus have? And Germany is handling the cases differently. But again, if that's true, if Germany is making an effort, as Lord Bios points out, different countries have different standards. So again, that also skews the statistics, all of that stuff. But Germany's fatality rate is really, really, really low. And if it's because Germany is making an effort to say not who died with the disease, but who died because of the disease, that is a fundamental difference, a huge difference. If it turns out that that's why Germany's mortality numbers are low, then and as Lord Bio says, could be an underestimate. We don't know. All of these caveats are in place, right? All of them. They're all in place, and I don't mean to gloss over any of them. But if it turns out that that Germany is only counting COVID-19 deaths that they conclude, for whatever standards or reasons, were people who died because of the infection and not as a result of having been positive for the infection when they died anyway. Forgive me for saying so, but let's just call these people who are 10 toes over the ledge. These are people who are basically on death's door, and either COVID-19 had nothing to do with their death, or it was the last straw for people who are already critically sick. If it turns out that that's the case, then the mortality numbers in terms of effective on the disease are very much better than they thought. Now, again, what's the meaning of this? Well, let me just do some quick little math for you, okay? Just a little bit of quick math. Let's go back to this slide. I'm going to just do some math that even I can do. Let's go back to where is it? Underlying causes. Cardiovascular disease, okay? Number one underlying cause from China, understood, early up to February 11th, understood. But for the sake of the argument, let's just look at cardiovascular disease, okay? So, excuse me for a moment while I do some on-the-spot research. This is just me using my reptile brain to do some basic math. There's probably all kinds of methodological errors here, but if there are, we're going to find out what they are, and we're going to learn our lessons, but stay with me. Cardiovascular disease. So here's what I'm doing right now in real time. I'm going to see number of cardiovascular deaths per year. Okay, heart disease. Stay with me, gang. 647,000 Americans die from heart disease every year. 647,000. So now I'm going to go into my handy calculator and I'm going to say 647,000 deaths per year divided by 365 equals 1,772 deaths per day. So it's 1,772 Americans die every single day from heart disease. If we want to start the clock of wherever you want to start the COVID-19 clock, let's see. This is March. Let's say we started 2 months ago. Okay, let's just say we started 2 months ago, right? If we start the whole, I'm just trying to sense some perspective. Okay, I'm not trying to make a medical case, and I'm not trying to give you an estimate. I'm trying to just get some general perspective out there. If we say that this COVID-19 thing has been going on for 2 months, 2 months is 60 days. So here's 1772 times 60 equals 106,356 people have died in the United States of heart disease in the last 2 months. 106,000 people have died from heart disease in the last 2 months in America. And so the question is, if these people, if all 106, again, we're just going to the extremes just to make a point. If all 106,356 Americans who have died of heart disease in the last 2 months, if every one of them had tested positive for COVID-19, again, just play with me here for a second, we would then say that there's 106,000 COVID-19 deaths in the country so far in 2 months. Clearly, those people didn't die of COVID-19. They didn't have time. They died of heart disease. So a question that really needs to be asked is, how many of the deaths and the mortality and all of the stuff we're seeing, how much of that is connected to pre-existing conditions to the degree where we really are talking about people with their toes over the edge? They just need not even a push, just a little breeze. I hate to be so flip about it. I'm not trying to disrespect anybody. I'm certainly not trying to minimize the death of people who doesn't really matter what your loved one dies of. If you know, it's a catastrophe either way. But what I am trying to do is get some kind of perspective on things. So one thing that is, I think, relatively solid ground is to say that in the last 2 months, 106,356 Americans have died of heart disease. And let's go back to this. That's just heart disease. And then you add to the heart disease people the number of people that naturally die of diabetes, chronic respiratory disease, all of these other things. If you look at all of those deaths, you're talking about large numbers of people. So the question is, how? I'm not even going to go with the question. I'm just going to make a statement. One of the things that I'm trying to do here is to just simply get people to understand the misleading power of statistics. So when we say there's, what is it? Oh, it's over 300 COVID-19 deaths so far this year. We have to ask ourselves, of those 300 deaths so far this year, what percentage of them are people who either would have died anyway without the virus, or that the virus has accelerated those pre-existing conditions and pushed them over the edge? In other words, the number that we should really be looking at is the number, because look, when we talk about, I'm talking about sociological things now. This is something I have a little bit of credibility with, not the medical stuff. I don't pretend to be an expert in that, and I've been corrected 100 times, and it'd be another 100 times would do me good. But just step back and look at this for a second. In the overall case of the country and the world, let's just get down to brass tacks here. What's going on now with the social quarantine and everybody else and everybody's anxiety is very simple. I don't want to die from COVID-19, and I don't want the people I love to die from COVID-19. That's what's going on. That's the whole thing. And so when you hear that the number of deaths is increasing and you see these 300 deaths and you see all of these measures designed to lower the deaths, all of this gives you a sense that that this is the only thing people are dying of. I know that I know that everybody knows that that's not true, but that's how it feels. And if you see a graph that basically shows the number of deaths due to COVID-19 going like this, in your mind psychologically, you think, my God, this is the total death rate for the country that's doing that. But there's no question that that's adding to the death toll. But again, you have to measure that line against the existing death tolls. In other words, look, we've had 106,356 people die since in the last 60 days in America due to heart disease. If closing all of the restaurants and everything else had helped those people, then you could make the case that we should have basically done this, 2 months ago. We could have saved a number of these lives, but closing restaurants doesn't seem to have much of an effect on heart disease. So again, I just want some perspective for folks. This is not all of the total deaths in America since then. This is just heart disease, but in the last 60 days, 106,356 people have died of heart disease, and that is a much bigger number than 300 and a much bigger number than 300. And all I'm trying to do is get people to put this in perspective. And to close this argument out and to close the show out, let me just put it to you this way. We all know people who've died of heart disease. It's the most common killer in America. And we've known people who died of cancer and all the rest of it. We have factored that death rate into our overall risk horizon. It's something that we grew up with. It's something that we take for granted. We know that a certain number of people are going to die of heart disease. It's the largest killer in America. We know that a certain number of Americans are going to die every year due to traffic accidents. We know that a certain number of people are going to die due to falling in the bathtub. Certain numbers are going to drown. Certain numbers are going to be hit by lightning. Certain numbers are going to die due to shark attacks, and so on. We have irrational fears of shark attacks because we don't put those numbers in the context of other things. And the same thing for being struck by lightning, because if somebody's struck by lightning, it's news. But 106,000 people have died in the last 60 days, and it's not news. And it's not news because we have already factored that into our overall risk horizon and our you could say, and our fear threshold. That number of 106,000 people is gigantic. And all I'm saying is we don't live in a state of perpetual fear of coming down with heart disease. Am I making any sense here? We don't live on a daily basis thinking, oh dear God, what if I get heart disease tomorrow? We'd probably be a lot healthier if we did have some more awareness of that, but that's not happening. We're not living in a state of panic. Again, this applies to diabetes, cancer, and all the rest of them, obesity, all of it. We don't live in mortal fear of coming down with heart disease tomorrow, even though many more of us are going to do that than come down with COVID-19 tomorrow. We don't fear that because it's known, it's part of the acceptable risk. We lost something like, I don't know the exact numbers, I want to say it's 40, 50,000 people died of the flu last year. And we know that the flu kills people. And I'm not saying that this is the flu, and I'm not saying that we shouldn't be doing the things that we're doing. All I'm saying is take a breath and keep it in perspective. Remember that 600,000 people worldwide died from the flu. Remember that when I say we put things in perspective, that's not to say we don't take them seriously. It's to simply say that COVID-19 is a new player on the stage. It has the potential to do enormous damage. 2% mortality in the United States is, 1% is 3 million people. 2% is 6 million people. That's an enormous number of people. But what I'm saying is that that 1% or 2% number almost certainly includes large numbers of people who would have died without COVID-19 being on the scene. So all I'm trying to do with this show and with the rest of these Coronasphere lounges is to simply say, let's let's understand that there's a new agent out there, that there is a new threat on our horizon, and it's a serious threat, and we have to deal with that threat. But what we have to do is we have to make sure that we put our total level of fear in an appropriate size box for COVID-19. And what's happening right now is that our fear of everything is attached to COVID-19. COVID-19 occupies our entire fear horizon. And what I'm trying to do, and what I'm going to continue to try to do, is to make people realize that there are so many other causes of death out there that we deal with on a daily basis that we don't even think about. We know when we get into a car that there's a chance that you'll be in a fatal car accident. We know it. We know that if you're eating too much, if you're 100 and 200 pounds overweight, we know that that is likely to kill you over time. We know it. We know that diabetes untreated or behaviors that lead to the onset of diabetes will shorten your lifespan. And we know all of this, and we do it anyway. Those numbers are far more massive than COVID-19 is. And we take those risks and we accept it and we go on with our lives. Now, all of this social quarantine and stuff, I'm not saying that this shouldn't be done. I don't know the answer to that. I just don't. There's no question. I think there's no question, none, that these draconian measures are going to save lives. There's no question about that. There comes a point when you have to ask yourself, at what point does the remedy do more harm than good? But we're not at that point yet, I don't think. So anyway, that's going to do it for this edition of the Coronasphere Lounge. I'll deal more with questions and so on next time. I'm going to be continuing to look for good news. I can assure you that if there's something that's genuinely bad news that seems to be statistically real, I am not going to gloss over it. But given the amount, it's the nature. We have two things going on here that we need to understand in terms of the fear level. Okay, I'm just going to reiterate these very quickly. There are two things that we need to do to understand why all of us, why our level of fear is so high. Number one is how the news is presented. I'm going to put aside the fact that it's clear that a lot of the mainstream media are trying to do anything they can to get Donald Trump out of office. Put that aside. Put it aside. Let's just pretend that doesn't happen. The reason that people are more afraid of this than they should be is because it is the nature of the news to come up with stories like, are you accidentally poisoning your children on a daily basis? Find out tonight at 9 on the Channel 6 Eyewitness News. That's how you sell news. No one's interested in the things that aren't happening. There are no reporters out at the airport with vans live reporting on the number of airplanes that successfully land and don't crash. All we do is count the hits. We never count the misses. When you think about a plane crash, you think about all the wreckage and stuff, but there's nobody there reporting that 40,000 times every single day for the last 20 years, an airplane has not, a major airliner, American airliner has not crashed in 20 years in this country. We don't count those, and you have to. You have to factor those things in. If you think about the risk of a plane crash, and all you do is think about the images of the plane crashes you've seen because that's all the news reported, if it turned out that you have a particular fear of flying, it's a very common fear. Imagine how you would feel if every single day you were subjected to a reporter who reported on every single one of the 40,000 flights that came in perfectly safe. If you had that information in your mind, emotionally, you'd be able to get a better perspective on the risk of flying, but we don't. So the news is in the business of of hyping the news to get ratings, but it's not even that sinister. Okay, it's not even that sinister. The vast majority of the lack of perspective in fear in the country is a result of the fact that the news only covers things that are worth covering. They're only things that are spectacular, interesting, different, or dangerous. If it bleeds, it leads, they said. So one aspect of why we're all as afraid as we are is that the news media is selectively taking the worst case scenarios and presenting them without any perspective. And again, if you completely take any political or ideological bent out of it, just take it out. Let's just say it doesn't exist. The news reports on a plane crash, but the news does not report on 40,000 planes that don't crash. It's just the nature of things. That's how news works. So we're seeing one side of the equation only. The second thing that we have to remember about fear is that it is in the human condition, the reason that we're here, the reason that this particular strain of human beings across the world, I'm talking about across the world, the reason that modern Homo sapiens sapiens is Homo sapiens sapiens is because somewhere back there in our past, natural selection took the people that don't worry out of the pool. And it seems to be the case that since evolution changes us so slowly, it acts over the course of hundreds of thousands of years and so on, we have not been safe, but for maybe 100 years in this country. I mean, really. In fact, you could probably make the case that we haven't been safe really since the invention of antibiotics as a culture. We are wired to be afraid of pestilence. It is the deepest fear that humans have. It hits us on a fundamental level because we have not been around long enough to have evolved some kind of reflexes that include things like, okay, now we know about viruses, we know how they're spread, we have antiviral medicines, we know how vaccines work. All we know from a hardwired point of view is this fundamental fear of something that we don't understand coming in and killing all of us. And the thing that is so terrifying about diseases is people feel like they can't do anything about it. That's hardwired into the human psyche. But that's not true anymore. We just haven't been around long enough to make that. People have to worry. They need to worry. It's a biological constant in the human psyche. And this is why nobody's talking about transgender bathrooms now, and why they were talking about transgender bathrooms prior to this pandemic. Because prior to this pandemic, we didn't have anything serious to worry about. So we had to invent something to worry about. And it's not just transgendered bathrooms, it's all the rest of this stuff. All of this stuff has to be raised to our level of worry. And when we don't have things that are serious enough to worry about, we will increase the seriousness of things that are relatively trivial and start worrying about those things like GMOs or something. You could make a good case that there's a problem with genetically modified organisms and so on. You could make a good case for GMOs maybe not being a good idea, but you only make that case when there's plenty of food. Because if everybody's starving and there's nothing on the table but GMOs, you're going to eat GMOs. So this is what I'm talking about when I say we got to raise the worry factor. So keep all of these things in mind. The news media, I'm not saying they're lying. I'm saying that they are selectively telling the truth for any number of reasons, but the single most important one is that's what the news does, is the news looks for the shocking. And again, don't forget the fact that there are, tragically enough, 1,700 people dying of heart disease, just heart disease, alone, every single day. We've had 300 deaths plus in the entire history of this pandemic so far. And again, when you look at the numbers in the last 2 months, it's 100 and, forget the number, 100, was it 106,000 people died just of heart disease? Forget cancer and diabetes, all the rest. All right, I'm starting to repeat myself. Anyway, you get the idea. So I'm just saying, be careful. Do the social distancing. It has an effect. And the last thing I want to say just very quickly is about the economy. I know people are terrified about the economy, and I know the economy is being damaged, and I do understand that a lot of this damage is serious and long-term, and I'm not trying to minimize that, but I want you to keep one thing in mind when it comes to the economy, and I'll keep this as simple as I can. There's a difference between not having a job to go to and having a job to go to that you want to go to, that your employer wants you to go to, but that you're not allowed to go to for some external reason other than an economic one. When we talk about these unemployment numbers and we talk about this drop in GDP and all of this, there are jobs waiting for us. It's not like we have to go and find them. We have jobs to go to. And all of this decline is due to the fact that we're being forced not to go to these jobs. I think that on balance, it's probably worth it. Yes, I think lives are more important than economics are. You can go too far, but for the time being, it's worth it. We're saving lives by doing this. But when you hear all of these numbers about this cascading catastrophe, I do understand that some businesses are being hurt enough that they're going to be out of business and so on, but I do believe that this is not the kind of thing that had people panicked when there were simply no jobs and no one was hiring. We have a booming economy. We have, if you take the political imperatives, the legal strictures, closing down restaurants and keeping people indoors, which again I think you can certainly make a strong case for doing for a while. Take that out of the way and the economy's booming. So when you think about these economic numbers and you think about all of this stuff, remember, you've got a job to go to. Some businesses are going to be in real trouble. The federal government is going to be writing a big check to bail people out. And I have to tell you, since this is what I do for a living and I try to make sense out of conservative politics and government bailouts and all of this stuff is really, really disturbing. With that said, the government writing big checks to small business owners to get them through this thing, that we're not talking about propping up failing businesses. We're talking about a national emergency, the likes of which we haven't seen for 100 years. I have been very, very, very impressed by everything I've seen on that front. I've been impressed by Uber saying, instead of tripling our delivery fees, we're going to eliminate them for the length of this crisis for food delivery. That's just cool. And that's voluntary. When you hear things like banks saying we're certainly open to, we're almost certainly going to have to either reduce mortgage payments for a while or eliminate them for a year or for the extent of the panic, of the pandemic, I should say, that's just cool. And this kind of goes to my Uber theory about social catastrophe, and that is that we have so much to lose. Our lives prior to this pandemic were so good that I cannot imagine a world where we don't go back to them unless we're forced not to. And the way we're forced not to go back to our previous lives is if 30% of the population dies. And that's not going to happen. And 10% is not going to happen. And 1% is not going to happen. This is temporary. I don't know how long it's going to last. I don't have any idea how long these quarantines are in place. I do suspect that they were put in place right as we started to hit that exponential growth curve, which is the point when you really need to make the interception. And then they're going to not be in place. And it's probably not going to happen all at once. It's not going to be like all clear, everybody go about their business. It's going to be, okay, now we're going to let restaurants reopen again or for a certain number of hours or whatever. And parenthetically, most of the actual risk of infection comes after the peak. Before the peak, people are really worried and scared and doing everything they can. Once the number of cases decline, people's behavior starts to get lax, and you can get the disease on the way down as easy as you can get it on the way up. So vigilance throughout this entire length of the curve is important. Every day that goes by, really and truly now, every hour that goes by is an hour where existing drugs are tested, where we get better data about things, where we learn how to treat people. It's another day where we can make more masks, and all of the deficiencies that we got caught with because of human nature, it didn't happen yesterday, probably won't happen tomorrow. All of those things are in motion now. This country, this juggernaut, this behemoth of prosperity is not dead in the water. It's chugging along. All of these cases of red tape are being slashed. I think the president's doing a great job, and I'm not going to just say the president, because when strong Democrats who politically hate Donald Trump and want to see him out of office, when Governor Cuomo and Governor Newsom and even Ilhan Omar say that the president's doing a good job, that means that we're all in this together. That's not a political win. That's just simply okay. We are now on a war footing against this miserable killer, and we're going to kick its ass. And we have not yet begun to fight. Every day that goes by, every hour that goes by, gives humanity, gives human ingenuity another day and another hour to step in front of this miserable, horrible genetic mutation of viruses and kick its ass. And that's what we're going to do. So despite the panic buying and despite the fact that, yeah, I was a tail gunner on a Charmin delivery truck back during the Great Epidemic, and despite all the things that we did wrong and all of the unpreparedness, put all of it, okay, these are lessons that we learn. Pearl Harbor was a catastrophe and we weren't ready for it, and we should have been. But after Pearl Harbor, in the years since Pearl Harbor, I've noticed that the United States Navy, it doesn't seem to be any position where we're going to be surprised by a sneak attack, and that's been 70 some years or 80 or whatever it's been. Okay? So look, we're doing the right thing with the social distancing, and the attitude of people is so unbelievably good. When banks willingly say, yeah, well, if we have to suspend mortgage payments for a year or more, then that's what we'll do. We're not going to crush you. We're not going to evict you from houses. We just know. The economy is sound. And people are going to need those houses, because when this is over, those jobs are going to be waiting, and we'll come back. And I like to think that if it results in the closure of a restaurant, where a restaurant goes bankrupt because of the loss of business, surely no one's going to sell that property between now and when these restrictions come off. And I understand that the financials and so on, but with a little help from the government, and this is one of the things that the government is there for. It's talking to a small government guy, but this is what government is for. So if government has to write a check for $1 trillion, write the check. If they have to write it for $2 trillion, write that check. I do think that if airlines have been buying back their own stock and then expect a bailout from the American taxpayers before they sell their own stock to recover some of their money, that I'm not so willing to do. But we can worry about that later. Right now, what matters is people's attitudes. There's a lot of fear out there, but people's attitudes have been extraordinary. And I don't hear the siren. I live in LA. I don't see rampant crime. I don't see people smashing windows and burning things. I don't see any of it. I become more proud of what we're doing as a country and as a planet every day. And every day that goes by is another chance for us to put this to work against these miserable little bastards. And as Lord Bios points out again in a completely separate way, for once not correcting me for my many mistakes, he points out that since we have to be here in this quarantine, we could make the best of it, I think people are generally doing that. But think about all of the things that you wanted to do if you could only get 2 weeks off. How many of you out there just wish, man, because I used to think this all, if I could just take 2 weeks off at work and not have to deliver anything, honestly, do that. Here's a chance to read, relax. The internet is still working, thank God. You can get a degree in something in the time you've been there. You can write, as G.K. Masterson says. Laura wins the internet for the today. Laura wins the internet. Yeah, you could also learn to code if you're a journalist. But look, there's a lot of stuff to do out there. And even if it's nothing more than just relaxing and watching TV, we work very hard in this country. And it would be good for the overall health of the country just to get some sleep and some rest and some relaxation. So just keep yourself busy mentally. California has said that we can go for bicycle rides, and we can walk the dog, and we can go for hikes. All of that's allowed so long as we do it indoors. Um, and uh, and so do those things. Just do what human beings do. Use your capacity for reason. Some of the numbers that we've talked about, some of the statistics that we've talked about, use your capacity for reason and make a decision not to be afraid. It's just that simple. And there's nothing else that you can do. There's nothing that's going to come and rescue you from your own fear except information and perspective. So if you're one of those people who are determined to be terrified about this thing, then the only thing that can help that is for you to make a decision to not be terrified about this thing, to put this thing in perspective. 300 total deaths from COVID, many of those likely simply attributed to COVID 19 with the pre existing conditions, 100 and some thousand people having died of heart disease. Put it in the box. Don't say there's nothing to fear, but put it in the box it belongs in. Put that box on the shelf, and then go around and start doing some other things and relaxing, enjoying time with your family, and playing Star Citizen, as the case may be. That'll do it for this edition of the Coronasphere Lounge. I feel much better about this one than I did about the last one. I'm going to try and be here every day at 6, even if it's just for a little while, even just to check in. But feel free to share this on YouTube with your friends if you have people who are worried. I think this is a lot more succinct and a lot more important than what we saw last time. So we'll be back, and if there's no news, then we'll just chat. And if there is news, we'll take a look at it. Our job is to report the good news, not to bury the bad news, and to qualify whatever good news we can find, as we did tonight. But remember, you're only hearing the bad news for the number of reasons that I've outlined, and your visceral gut reaction is to ramp your fear levels to the absolute top level, because that's what happens to people who don't know what disease is and don't know how to fight it, and we're not that species anymore. Okay, so we will see you tomorrow right here on the Chronosphere Lounge. Thanks very much for joining us. Keep your chin up, have some fun. Jokes are good, and take care of yourselves. Do the right thing. We're going to be back in business as a country sooner than people think. All right, see you tomorrow. Bye bye.